Hi, so today I'll be discussing my sway project that's based on our proposal essay. And my proposal essay and project focused on the ethical dilemmas within aesthetic nursing. The main problem that I addressed is the growing lack of ethical standards in aesthetic medicine. As the field is increasing in popularity, this growth also leads to ethical concerns, um, social pressures from social media, and the fact that aesthetic procedures are becoming more accessible in modern society. People seek out procedures that are not necessarily medically necessary, and this creates blurred lines of ethics and morality for people who practice in the field of medicine. I'll specifically be talking about nurses today, but this also applies to surgeons, to various other medical professionals within aesthetics. Specifically, over 75% of doctors believe that aesthetic medicine is facing an ethics crisis, and this statistic just kind of shows how impactful this issue is becoming and how many practitioners agree that this is a huge deal. This topic personally interests me because I'm interested in the healthcare field. I am working on getting my nursing license, which is going to be super exciting. And I just wanted to learn more about aesthetics specifically because I'm interested in it as a potential career. And I just wanted to learn about maybe some of the issues that are happening in the field and maybe how I can address them moving forward in my career. So, the intended audience for my project includes not only just aesthetic nurses, but also lawmakers and medical boards. And I chose them as my audience because they have the most power to enforce change and to mitigate these kinds of issues. Patients are the people that are most likely going to be affected the most from ethical issues. And it is the responsibility of the practitioner as well as medical boards and those who enforce regulations within the field to fix these types of issues in order to make sure that ethical and safe practice is happening within the industry. So, some of the perspectives that I explored were a few from different scholars and professionals within the field. So, one of the first perspectives that I found was that some people believe that aesthetic medicine as a field goes against the principles of medicine because these procedures are often not medically necessary, and the quote unquote purpose of medicine is to heal the sick, to fix people who need help. And aesthetic procedures are usually not necessary. They do not necessarily fix health issues. They're purely for personal gain or personal enjoyment, if you will. So that kind of presents its own issues for nurses because the things that they're doing, they're not necessary. And if any issues arise, let's say after the procedure, the patient has blindness, that procedure wasn't necessary. So how it's difficult for nurses to gauge how they should explore these kinds of moral issues within their field. A second perspective is that researchers found that people who spend a lot of time online or women in society feel especially pressured to get aesthetic procedures done because they feel pressure to uphold beauty standards. Um, yes. Another perspective that I found is that there is a lack of training within the field. A lot of professionals, especially aesthetic nurses, are concerned about the large amount of people who are not trained in aesthetics, um, providing care and doing procedures on patients. And this creates major safety risks. This is not morally right at all. And some people also argue that these people are simply in the field for their own personal and financial gain, and they're capitalizing on the insecurities of their patients instead of actually providing medical help. I chose these three perspectives to focus on because they show different sides of the issue, and they also show that the issue of ethics not only affects patients, but it affects the industry, the respect for the industry as a whole. It affects society by enforcing these standards and pressure to get procedures done. There are various perspectives within this issue, and I thought that that was pretty interesting. To highlight some of the visual elements that I used, I included this video that kind of goes over some values, morals, and ethics within the field and how nurses should approach ethical dilemmas. I also decided to use some statistics here and over here just to show like the gravity of the situation and how many people are affected by this issue. And I also used these little cards. I thought this was cute. And I felt like these elements were effective in showing that this is not just words on a screen. There are many people who are being affected by this. The statistics show the gravity of the situation. The video kind of adds a different element and explores, it's someone speaking to the person who accesses my presentation. They will see someone speaking to them. And I feel like that adds it's more effective in expressing the gravity and emotion. So, to explain my solution focuses on safety, integrity, and respect within the field, and hopefully these aspects will improve ethics, transparency, and consent. The five main steps that I outlined were establishing training standards, enforcing certification laws, requiring ethics training, recognizing aesthetics as a medical specialty, and requiring recertification. And this solution works because it creates consistency and a common standard across the field instead of having people who, instead of having no standards, there are standards being enforced, and people are forced to meet these requirements and meet these standards in order to practice within the field. So there's a common ground, there's a common standing, and there's a common understanding of what needs to be done within operating on patients and where to go from ethics, how to have medical integrity, all of these values. I thought that this little card thing specifically was effective because it focuses on one step at a time. Instead of just listing all my steps here or in bullet points, you can kind of go through how things should be done and the order in which they should be done. So first you establish the standards, then you enforce them, then you require ethics training specifically, then you recognize aesthetics as a medical specialty after standards have been enforced, and then you would require these professionals to continue their education and continue getting credits to stay updated on their practice. This solution is realistic and feasible because similar systems already exist in various other areas of medicine. The only reason why these aren't being enforced in aesthetics specifically is because aesthetics is not respected or recognized as a medical field, which is a major factor of the issue. For example, almost all medical specialties require you to continue gathering credits after you have your license in order to make sure that you continue understanding the standards of your practice. And these training standards, the certification rules, the ethics requirements, these would not provide or create anything new within the industry. These would just utilize systems that are already in place in other specialties. And that addresses funding issues as well because funding should come from medical boards that already spend money on other specialties. And specifically recognizing aesthetics as a specialty is also feasible because medical boards are regularly updating and recognizing new specialties as medicine continues to grow, because medicine is a field that changes and grows continuously. And yes, so as a call to action in my sway, I directed my call to action to lawmakers and medical boards and various other related organizations. Basically, anyone who is in the field that can make a change. And my call was for them to enforce standards to ensure safe practice. And this is an issue that involves the safety of the patient, which should be the priority for any practitioner, especially aesthetic nurses. And I decided to emphasize the fact that if change doesn't happen soon, the field is only going to continue declining in standards and patient safety, and people will stop trusting aesthetic professionals and aesthetic nurses because there's no standards, there's no trust. I think that this is an effective call to action because it outlines exactly who needs to be doing what and why this issue matters. So, to close up and to have some concluding thoughts, I felt like this project really opened my eyes to the various issues that are occurring in aesthetics. I thought it was interesting to explore ethics instead of something like the safety of this specific procedure. Ethics is can be objective, but there are certain standards that should be enforced. And I felt like this was a important issue to research and to think about because patient safety is super, super, super important. And a lack of regulation within this field can create so many issues and allow for so many unsafe practices, which is incredibly harmful and risky. Working on this topic and this paper and now this sway this semester has just shown me how valuable it is to have trained professionals and to have standards within the field, because a medical field without standards is just a community of individuals who may or may not understand the gravity of the situation or understand how impactful their actions are. And it is important to solve this issue and continue researching this and discussing this in order for a common ground to be achieved. One of my favorite parts of this part of the semester, this whole project, the essay and everything, was probably my research because it was something that I was personally interested in. The research didn't feel like it was something that I was doing for a school project. It felt like something that I was learning for myself and I was personally interested in, which was a lot of fun. And I think creating this way was also fun as well because it allowed me to kind of tap into my creative side and make a little presentation. So, yes, thank you.